Welcome to the Possibility Action Network podcast. I'm your host, Stephen Middleton, aka Possibility Man. We're committed to bringing you guests who strive to better people's lives and serve as a force for good in the world. Our guest today is Dr. Bijoy John. He is a board certified physician and sleep specialist who treats patients of any age with various sleep disorders. He's the founder and medical director of Sleep Wellness Clinics of America, which provides in person and online consultations. Dr. John is also the founder of Sleep Fix Academy. In addition, he is an assistant professor and a top sleep specialist award recipient. He's the author of the book, Nobody is Sleeping. Dr. John, welcome to the show today.
Steven, thanks for having me. All things are possible when you sleep great, right?
Uh,
Sleep is the superpower. So all the entrepreneurs and all the people that you reach, they're hustling, they're working, but they can be superpowered and supercharged if they focus on their sleep. Because once you have sleep, boy, you got everything.
We're going to dig into that today for sure. But first, let me make this announcement to our listeners and our viewers. Follow, like, and share this podcast wherever you find it. It helps us attract guests like Dr. Bajoy John. Hey, Dr. John, let's get some technical things out of the way first. You are a board certified physician. We see this all the time, but we don't often know what that means for a doctor to be board certified. What is that? What does that mean?
That's the gold standard, right? So after the training, we go through this intense examination process, right? And then before that, you have to meet many, many credentials and requirement by the state, by the institution, and from the board. So that means you are very much verified, right? And especially, I have four specialties.
Wow.
Once a regular doctor, then I'm a lung doctor, sleep doctor, and also an ICU doctor. So the sleep boards are the hardest boards because why? You're competing with other people who are also very, very brilliant, right? It's a percentile of the best of the best.
Hmm.
So when you say a doctor is board certified, especially in sleep medicine, you're like, wow, that guy, has gone through a lot, a lot
Uh-huh.
of schooling, a lot of work, a lot of hard work, and
Uh-huh.
a lot of call of duty. So that
Yeah,
means that's all it means.
that's great. So, in one way of looking at it, we can say that, being a medical doctor is great. You're ready to practice, but then being board certified is another notch above that. Yeah. Okay. That's great. Hey, look, so what does it mean to be a sleep specialist? When someone is a sleep specialist, what does that mean?
So the whole field of sleep medicine is about, I mean, it's been there for a long time, but as a
Mhm.
specialty, it's about 50 years. So it's been steadily progressing in the last 10 years, 15 years, especially with the diagnosis of, sleep apnea. And of course, many people don't sleep. That's called insomnia. The whole
Yeah.
world is not sleeping. That's why, I titled my book like Nobody's Sleeping.
Yeah.
So from a young age, I found out the power of sleep, through med school. Nobody sleeps, right? So exams. But then I found out, hey, if I sleep better, I'm performing the exams better. Same
Yeah.
thing, when I was in ICU, there's no sleep. We pulled long shifts, but I was crap. I was in a bad mood. Then the same thing with the patients. So if you leave them alone for a shift and not wake them up, they
Mhm.
actually heal better, right?
Wow.
So in the ICU, it's called something called delirium. People get all riled up. So and then when I was dealing with grief of my mom, I was in a funk, and then I had to you know find a way out of it. Same thing when I started my business, a lot of bills, employees, but I found a way. So through this journey, I know the power of sleep. I've lost it, then I've gained it, and I said, let
Yeah.
me just put it into play and share it with the world. So I'm a first-hand sufferer of sleep problems, and then I have the remedy. So in essence, people are now realizing how important. I'm so excited in this new
Mhm.
phase in the time. Everybody is focusing, like even the great athletes and everybody else who are at the top. If they ask them what is the best self care they do, they all say sleep. I'm so
Wow.
excited about
Yeah.
that. So
Well, that's exciting for sure because Many of us suffer from poor sleep. What are some of the common causes of poor sleep?
Well, we live in this age of information.
Yeah.
The number one cause is our need to be connected, need to know, need to have an opinion. And what do? We spend time on our social media and on our devices.
Uh,
So, we have to work, we have to do all those other activities, and we dedicate 8 hours to sleep. But then we have this new friend, our cell phone and our social media access, and that needs time too, 2 to 3 hours. Where is that time coming to be on that? Is from compromising on your sleep. So that's a huge thing. And then after COVID, what happened? COVID changed all of our sleeping habits because people started working from home. There is no time to wake up. They sleep in, they go to bed later. It shifted everything. Then people started bringing all the devices to the bedroom, and the light from all the devices don't help us sleep. And of course, all the angst and the anxiety when you are on the phone, the bullying, the messaging, we want to answer everything. So, and also just the COVID stress of being COVID, it's called a coronosomnia, just the fear of getting COVID or all the doubts. I coughed a little bit. Maybe I have COVID. I have a little temperature. Maybe. So all that. So between the social media use and the cell phone use and the COVID virus pandemic, we are a sleep deprived nation and also sleep deprived world, because this is a global, I call it the new pandemic. It's
wow.
we are walking like zombies, sleep deprived state.
Mhm.
We are irritable, we're less productive. Poor sleep worsens mental health, so it's affecting all of us in many ways.
Yeah. In your writings and in some of your speaking, I've heard you actually say that you experience sleep problems falling asleep and even insomnia. Can you tell
Yes.
us about that?
Yes, when my mom passed away, I was, going through grief, and I was like, I can't get snap my mind out of it.
Mm,
And of course, long hours of studying for the exams, it was counterproductive, and the same thing with when you run a business, like most entrepreneurs and business owners, a lot of decisions you make. So what I did, this is one of the seven strategies I do. How did I overcome that? So if
mm,
I'm something to worry, what I do, I take a dedicated worrying time. Every day I do that between 6 p.m. and 8 p.m. Right?
mm,
What I can do, I write it down for the next day. I don't take it into my bedroom and lay down and start worrying. I'm done. Within
mm.
a week of doing this, your mind is like, hey, I got to sit on that table and worry, not in bed. So this is one of those, not many people speak about it. Everybody knows phones are not good on bed, because of the light.
Uh,
But I am teaching these new things to people, and people are wow. And
mhm.
I've been implementing it for many years, and I have many successful patients and clients who are happy.
Yeah. I'm going to look at this a little more carefully. From what I heard you say is that you can actually devote time at your table and say in the evening, this time is for me to worry.
Yes,
And then you
yes.
plan your next day
Hmm.
and you're able to not take it into the bedroom. Some people are going to say, I can't turn it off, but you're saying that it's possible.
Yeah, with time.
Uh-huh.
See, that so then the bedroom becomes for sex and sleep. Not for snoring or worrying. See,
uh-huh.
your brain okay, we all worry. We're born into this world. We're going to worry, but take your time. Do it outside.
Yeah.
So that's what I
Yeah.
tell people.
I like that because you're telling me that the brain can be educated to know that at the table between 6 and 8 or whatever, here you
Yes,
can do what you do. But once you hit that bedroom, it's about something totally different. I
correct.
like that. Yeah,
Yes,
that's,
it's
that's,
very
that's
simple. If you look at it, you don't sit in a dinner table to get hungry, right?
right,
You
right,
only
right.
go there when you're hungry. Same
Yeah,
thing in on your bedroom. You're not laying there to get to sleep. You're only
yeah,
laying there ready to sleep. So you've
yeah.
done all the other things outside.
Yeah. Dr. John, I think that's a very attractive. You're saying you can train your brain
Yes,
to do your worrying, your whatever it is, or whatever,
yes,
even during the day. So, what? That's not today. That's not
yeah,
now. That's at 6 o'clock. I like that very
exactly.
much. All right. So, let's talk about some of the harmful effects of sleep deprivation.
Right. Great question, Stephen. See, The challenge with sleep problems is that it doesn't hurt like a toothache, right?
Mm,
It doesn't grow like cancer. So we ignore it. We unless that's why I've taken on myself and many people like you to bring it to the awareness of people. Hey, the sleep problems, and that's why that I said that's a great question. So these are the some of the subtle symptoms of sleep problems. Being tired and grumpy, you're not in a good mood, you're snappy at everybody. You're not a
mm,
good employer, you're not a good employee, you're not a good student. Whatever you are in class, sleep deprived, the brain is not ready to organize all that. See, whatever the information you get, you have to sleep. That's when the brain puts it in certain places and organizes it. You lost that power. And of course, poor sleep can cause you to, can have an accident. You're not, like if you're sleep deprived, it's almost like being drunk.
yeah,
They did
yeah.
studies. It's almost like blood alcohol level of 0.05, which is legally drunk in certain states like Utah, and it's like that's the thing all over the world. I think most states have 0.08, but it's like being drunk. Your reactive time is not good,
Mm,
and of course, when you don't sleep well, your blood pressure, which is supposed to go down at night, is high. So if any of your listeners are having high blood pressure, the easiest thing to look into is sleep disorders. And
wow. Mm,
same thing with the diabetes. Your glucose level goes down low, but if you don't sleep well and if you have episodes like apnea that wakes you up,
mm,
increases your blood sugar. Same
mm,
thing when you sleep, there's system in your brain called the glymphatic system, which clears out all the muck. That prevents us from getting dementia. So
mhm,
that's only that pushing thing happens only when you sleep,
mhm,
right? So
mm,
that's not happening.
yeah.
And most importantly, we heal in our sleep. Stephen,
Mm,
when you have
mm,
a problem in our life, what do we tell ourselves? Let's sleep on it.
mm.
Nobody
Yeah,
says let's work out on it or
yeah,
let's feast on it. So we have healing in our sleep.
yeah.
We do grow in our sleep. The whole human growth hormone is secreted in sleep, and it's very
Mhm,
important for smaller children. It's also important for us because the human growth hormone helps muscle metabolism and growth.
mm,
So sleep is the foundation for working out,
mm,
because it gives you the energy to work out, and it also heals our muscles. So
mm,
to answer your question, being tired, being in a grumpy mood, not a happy person. If you have
mm,
anxiety, depression, your symptoms are getting worse. So you're not a happy person and you are not leading your full life. And your
mhm,
cognitive problem, your blood pressure is high, your diabetes is high. Not to mention when blood pressure is high, you can have a stroke.
mm,
So
mhm.
these are some of the warning signs.
Yeah. Oh, wow. That's huge. You've already mentioned depression and anxiety and stuff like that. So I want to underscore because you clued me that there's a relationship between sleep and mental health. I don't think I considered it until I began looking at you. So underscore that for us, that connection between sleep or sleep deprivation and poor mental hygiene.
Right. So so I have a picture. I even know the page of my book. It's page number 89. I have a cycle. Poor sleep, anxiety, depression. Poor sleep worsens anxiety and depression, and
Mm.
anxiety and depression causes poor sleep. It's a vicious cycle.
Wow.
So you can break that cycle very easily by focusing on your sleep. So practically, when people, I get a lot of referrals from the psychologists and psychiatrists with people with such problems.
Mhm,
So once they fix their sleep, they're able to come off many of their, antidepressants, because now you're able to sleep and you're able to heal better.
mhm.
You see what
Yeah.
I'm saying?
I see
So
what you're saying.
yes,
Yeah.
it's a vicious cycle, and by sleep,
Gosh, yeah, I mean, I like the way you say that, Doc. Because we think that it's the vicious cycle that's causing your depression. You're locked in that
yeah,
cycle. But you're saying is that you possibly can end it, slow it by just getting better sleep.
yes,
That's amazing.
yeah.
Yeah.
I have a handy dandy book next to me. Since you stayed on that, this is the cycle. This is the picture. That's it.
Uh-huh. Yeah, I see it. If you're listening, he's showing us his book. Is that the book, Nobody is Sleeping?
Yes, nobody's
Okay.
sleeping. The seven
Okay.
proven strategies.
That's great. That's all right. Hey, look, so let's talk about Well, you treat adults as well as teens.
Correct.
Gosh, children have sleep problems?
Oh my God, they are the majority of my clients.
Oh,
So children, especially teens, have something called a clock problem, right? So when you're a teen, because of the hormones are jiggling, right? And that actually pushes the clock forward. What's 10 for us is like 11 for them. But then teens also have a lot of extracurricular activities at night. They stay later at night, and so they push the clock. So teens, from because of the behavior and also the natural tendency, go to bed late, wake up late. It's okay on Friday, it's okay on Saturday, but then Sunday night, if you go and sleep in late, then you have to wake up at morning to go to school. So schools
mhm,
are working. Some of the schools in California have delayed, time to go to, go the school start. In college, what do the kids do? They schedule classes later, right? So so that the clock continues to be like that. See,
mhm,
in the past, when kids graduate from college, you have a 9 to 5 job. But now with COVID, that clock is continuing to be forward because you can work later, wake up later. So the clock reset in adulthood doesn't happen to most of the kids, students graduating from college because they wake up later. So most of the kids that I see, they say they can't sleep. Now they come and try to go to bed at 10 o'clock. You're not
mhm,
falling asleep because the clock is moved to one. Their normal time to sleep is between like 1 to 8. You with
mhm.
me?
Yeah, I'm with
Uh,
you. Yeah.
So then they're struggling for 3 hours, and I get a lot of calls from parents saying, "Hey, my kid's not sleeping," but it's actually not insomnia, difficulty to sleep. It's actually a clock problem. So I work with them to change it.
Wow. I mean, it must be difficult. I'm just assuming to
Yes.
diagnose a sleep problem. I want to save adult problems and sleep apnea for a moment, but it
Yeah.
must be difficult to diagnose what's going on. Is it?
No, it's actually easy
Mhm,
because we have home sleep testing. 20 years ago, the last 10 years, we have been strong on the home sleep study. I only do 100% home sleep study,
okay.
except I think of some rarer conditions. So I use like a watch-like device. People sleep with it. So everybody's afraid, hey man, I don't want to go in a strange environment. Now we do everything at home. It's easy. So if you're
Mhm.
snoring, and if like I mentioned, the sleep problem, if you're tired, you have a 99% chance you have sleep apnea. So,
Wow.
yeah,
Mhm. Okay. So you mentioned, oh, before we talk about sleep apnea, because I want to talk about that in
mhm,
adults, but you floored me with this one. You said there's a connection
yeah,
between sleep and weight. What?
yes. Oh, so it's actually a huge connection. If you don't sleep, that means you have more time you're awake. That means you have more time to eat. That means the more time you're not making the right decision.
Yeah.
When you're tired and cranky, what you're doing, you're going for the high glycemic foods, the chocolate, the sweets, the sugary drinks. You see what I'm saying?
Yeah.
The colas. You're just trying to feel good. So
Yeah.
very, and
Yeah.
so that's the easier part. But in a
Uh,
scientific reason, there are two hormones that control our diet. They're called the leptin and the ghrelin. So leptin lowers our appetite, ghrelin increases our appetite. When you sleep well, that balance is good. When you don't sleep, it's the other way around. We have
mm,
more ghrelin. So you're
mm,
hungry all the time. So
mm,
if anybody who wants to work out, anybody who wants to lose weight, and anybody who wants to feel mentally better, focus on your sleep. I'm working with a local Nashville fit community, and I
mm,
speak at their conferences. I tell them, imagine sleep is the foundation on which diet or weight loss and exercise is built. Period. Full
mm.
stop. That's the message.
Wow. I mean, that question, how's your sleep, applies to a lot of things that people can be dealing with. Okay, so I want to talk about adults for a moment. And I want to start with the big thing that I'm hearing more and more about today, and that is sleep apnea. Now, for
Yes.
those of us who haven't talked with a doctor about it, what is it?
Okay. So everybody talks about sleep apnea, but there's a word prior to that. It's called obstructive sleep apnea, there's literally an obstruction. The
Mm,
obstruction happens in the back of the throat. The tongue falls back and closes the airway. So
mm,
now there's not much air flowing through, and the brain senses it and says, "Oh, there's a lack of flow. Let's wake him up." And you go, "Wake up." It's not
mm,
physical awakening, it's subconsciously you're awake. Then you take a deep breath, and again you fall into sleep, and then again that closure happens. So multiple times you're woken up. And if it's complete closure, that's when your spouse says, "Hey, you're not waking up."
mm.
When there's partial closure, that's when the snoring, snoring is nothing but
Yeah, yeah.
vibration.
Mm,
Imagine this is a pipe and I'm narrowing it, and
mm.
then there's the same amount of water is flowing through a narrow passage. It creates a turbulence. So that's snoring. And usually it's on your back. That's why the spouse elbows you, then you roll over and to the side, and that's the rescue valve opens up. So
Mhm.
so obstructive sleep apnea is one of the leading causes of multiple health problems in adults.
Wow. Mm. And so there's obstructive sleep apnea and there's also sleep apnea, or are they different?
There's a there's something called central sleep apnea, which is
Neutral.
rare. Central means from the brain,
Mm,
you know. So sometimes you can have problems when you take like sleeping pills, pain medications, which suppresses the breathing system, right?
mm,
Or if you have certain abnormalities of the brain that is closer to the respiratory center,
mhm.
it can cause central sleep apnea. So if you say sleep apnea, that means 95% chance you have obstructive sleep apnea.
Okay.
Then there's 1 or 2% you have central sleep apnea, and then the
Ah,
3% is combined. You could have a mixture of both. So when you say sleep apnea, it's 95% obstructive sleep apnea.
okay, good. All right. So well, firstly, can it be healed?
Yes.
I mean,
So
permanently.
yes. So if you weight gain is the number one cause of obstructive sleep apnea. And of course low testosterone, low estrogen, all those things can you know cause our tissues to be much more lax and cause uh, you know more narrowing. The tissues gets relaxed and collapses. So weight gain, if I am seeing somebody and say, how do I cure sleep apnea, the first thing I say is, can you lose some weight?
Ah,
And so that's a huge response.
mm,
In children, it's the narrowing is because of the tonsils and adenoids.
mhm.
Both my children had sleep apnea because of that. We took them out and they're 100% cured, right? Some
Okay.
people also have a narrowing of the nose. Some people have big, palate, and you can do a little bit of surgery to clear that out. But when the sleep apnea, if it's medium to severe, then such treatments, the weight loss and the minor surgeries don't work. Here you have to use treatments like CPAP, and
Mhm,
then there are newer technologies like you can move your jaw forward with an oral appliance. You can have a pacemaker kind of device which gets the tongue out of the way. Then it's a
mhm,
device to strengthen the tongue. So there are a lot of new treatments to cure it permanently. In children, you have to take the tonsils adenoids. In
mhm,
adults, if you have a little bit overweight and that's the cause, and if you have mild sleep apnea, you can cure that permanently by losing weight.
mhm. So, what is your preferred treatment for sleep apnea?
The
What's your
preferred
go-to?
treatment is
Yeah,
CPAP, or continuous
CPAP.
positive airway
Mm,
pressure, which has been studied. It's been around for 40, 45 years. You blow air literally through your nose into the back of the throat and gets the tongue out. It works 100% of the time. So that's
mm.
the gold standard treatment. But the
Okay.
other things people are not tolerating, we can try that.
So with the CPAP, I mean, so how does it? I've seen those things on commercials and all over the
Yeah.
place, on Facebook. How do you know when it's working? How does the patient know when it's actually working?
Okay, the machine, we nowadays we set a range of pressure. Let's
Mm,
say your airway needs 6 centimeters of pressure to open up. We dial it down, so I have a range between 6 to 12, and then the machine keeps track of you, and it's got a cell signal which sends data to us daily, and then we can see if how much your apnea has improved. So we
mm,
are able to track it. Uh, every day. Just and
mhm,
then patients also have an app. They can look on the app to see, hey, how was my apnea last night? So
mhm.
we can have.
Okay. Now, so in sleep apnea, doc. So does I mean a person? Look, I deal with sleep apnea. So
Yes,
case in point. So I'm told that that I stop breathing
yes,
sometimes at night. Does
yes.
so is it important for me to wake up or trust the machine to help me during that time?
Oh, the machine will do it. Machine will adjust how much pressure you need.
Yeah,
Machine, I tell people the CPAP machine or treatment of sleep apnea is the insurance policy when you sleep. We have insurance policies for everything during the day, but that's one when you sleep at night. So,
yeah.
so make sure you wear it.
Okay, so I got fat, doc. So I'm gonna lose some weight. I'm gonna get up for this this machine.
Yes, yes,
So you've mentioned it already. You said that sleep is a superpower. Tell
yes.
us more about that.
So, when you sleep like rested, when you wake up in the morning after a great night of sleep, you're like ready to charge. I mean, I have found out over my own perils that I've found out the secret and the power. So in the morning I'm ready to go. I'm working out, uh, you know facing the first client. I have energy in the afternoon, I have energy in the evening. So you feel rejuvenated, so you can be a better version of yourself. I believe, we focus so much on so many things, but then we also need to focus on this power that we have. It's free, it's within ourselves. It is a discipline. But the challenge here, Stephen, is the hustle culture is going at a rapid pace, but the sleep is a kind of like an art. It's a
Mhm,
slow paced thing. So the
mhm,
yin and the yang, how are you going to mesh? That's the challenge, and that's why it's great to hustle. You'll be a better hustler if you if you sleep better. That's my
right.
message.
Yeah, yeah, I hear you. And from what you're saying, is like many of us probably have sleep problems and aren't
Yes.
aware of it. We're
Yes.
overweight, we're tired, we're grumpy. All of that's an indication that something else is going on with our sleep.
Yes.
Mhm.
Got it.
Okay. All right. So now you offer a course, I
Yes.
think it's a course called Sleep Now.
Yes.
Tell us about that.
Yeah, that's a secret. You have to take a course. No, I'm just
Oh,
kidding.
okay.
No, I want everybody to get all the information, all your viewers. So it's called Sleep Now, SLEEPNOW, right? The
Okay.
S is the schedule. We have to have a schedule, like any plan to succeed. So I prioritize sleep between 10 p.m. and 6 a.m. You can be
Mhm,
30 minutes back and forth. That's fine, but make sure you dedicate, hey, it's time to rest. I've
yeah.
had 16 hours of hustling or working hard, doing what my best. Now I need to recharge my brain, my whole psyche, my body, my mind. So
Mhm,
schedule is good. Then the next is L, is the low light, low noise, and low temperature.
mhm,
Why
mhm,
is that important? Because we have tons of melatonin. Our body just can secrete so much melatonin, but melatonin is only secreted in when in darkness and lower
mhm,
temperature. The word mela means darkness, right? So
mhm,
that's why I tell people the next SLE is electronics. You should not have your electronics in bed. The light, especially in a dark room,
yeah.
just goes straight into your brain saying it is still daytime. I tell people to get off electronics at least 30 minutes, prior to going to sleep. So
Mhm,
that's the next in the E, in the acronym E, is exercise. Exercise releases endorphins and also it generates heat. Remember, the melatonin only secretes in darkness and low body heat. So when you exercise closer to bedtime, you are that's counterproductive. So the next,
mhm,
yes. So try to exercise earlier or during the daytime. I do it first thing in the morning, and then in the acronym SLEP is powering off your mind. So you
mhm,
can only do this. You've done, no electronics. You're not revved up state. You're preparing your body. When you lay in bed, power off your mind. I teach two techniques, and
mhm,
these are the things how to do it is in my course. One, I tell people used to do your imagination out of not reality, but the abstract. Remember I said in bed not to have in all those real life stuff. Then you have to think about something totally different, right?
mhm,
And then I also teach this 8-second technique of how to relax with something called yoga nidra, nothingness. So these are some of the things that I'm introducing to people. Everybody knows about the light, but this is at a deeper level. And then the P means power of your mind.
Mm,
That's the P. Then after the P is no, no to worries. Remember, we said
yeah,
to have a dedicated worrying time, 6 p.m. to 8 p.m.
yeah.
If 10 o'clock is my bedtime, I'm getting ready by 8 p.m. to getting into this mood, you know, of sleeping. So dedicated working time, we talked about it. And then the last in the acronym sleep now is W is win by losing yourself. We want to win, win, win,
Mm,
but we have to lose and keep everything kind of simple. So that's
yeah.
the acronym I use. I tell people what's the summary of this acronym, and Dr. John, that means when you're entering the bedroom, it's like a TSA screener, right?
Mm,
No cell phones, beep, no worries, beep, not no like tight clothes with all the belt and comfortable clothes. So you're getting into the bedroom in that mood. You've done everything outside the bedroom.
mhm.
So that's an analogy I give people. So I'm able to relate to people in that level.
Yeah.
So that's been practical.
I love it. I mean, a lot of the things that we've seen on television, like reading after 10 o'clock,
Yes.
with a lamp. You would say, is that a good idea, Doc? Is that a good idea?
Reading is good, but make sure you read outside. You
Uh-huh.
just, and people listening to meditation music, I encourage that, but it's tied to a phone. But then you are on your phone, meditation music, then a text
Uh,
message comes up, you see the diversion.
yeah,
Do in the zone outside, leave
yeah.
everything out. I'm a huge fan of reading, I'm a huge fan of meditating music,
Mm.
calm, all that, but not in bed.
Not in
Bed's
bed.
only
Yeah,
bed's not for all that. You just have
yeah.
to relax and enter into this tranquility state.
You and I, we're in the United States and
Yes.
Western world, a lot of abundance, and some of us have put televisions in our bedrooms. What do you think? Good idea or not?
It was 1999. It was Al Gore versus Bush. I
Yeah.
had a television right there in my bed. I couldn't sleep. I was right in the middle of my fellowship. I was in my sleep fellowship. I was like, the next day I was exhausted. Just click, 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 click.
No.
So the next day morning, I did the research on it. Within a week, I took the television off. And
Mm,
to this day, no television in my bedroom, no television in my children's bedroom.
yeah.
Because when you have access to something, you're going to use it. Same thing
Yeah.
with the
Yeah.
phone. Remove it out. A lot of people have that. So I say, hey, are you ready? It's like, are you ready to work out? People go buy dumbbells. Are you ready to sleep? Take the TV out. You are
Yeah.
getting the power in your hands. Move it out and
I
let it
love
be
it.
easy.
I love it, Doc. And you wrote this beautiful book. Nobody. I like the title.
Yes.
Nobody is sleeping. How did you come up with that?
After a great night of sleep, my publisher wanted sleep strategies. And then
uh,
I woke up and I said, you know what? This is a pandemic. Nobody is sleeping. And
mm,
if you're sleeping, this book is not for you anyway. So,
mm,
and then I used the subtitle, the seven proven sleep strategies. So it
okay.
actually came out in my, and people loved it. They have
Uh,
never heard a title
well,
like this.
yeah. I mean, that's great. Great title. Great primary title, and also the secondary one. So, why did you write this book? What do you want your reader to get?
See, I'm
Ideally,
happy.
ideally now, ideally. Yeah.
Yeah, I'm happy. A part of that happiness, I think, comes from my deep restorative sleep.
Mm,
I'm like everybody else. I suffered, but I knew the beauty of it because even the exams, if when I slept better, I did that better. I'm like, there's something here, right? So I seen that in the ICU when let patients sleep a little bit better,
mm,
and then in practice when I'm able to sleep, everybody's sleep problems, correction of the insomnia, sleep apnea, they're functioning better. They're so happy.
mm,
Most people wake up in the middle of the night to use the restroom. That's because you have untreated sleep apnea. The first thing they said, I'm able to sleep great. So
mm,
so I said, I am doing it. I have sleep apnea myself, so I do treat myself. So once I've done all this, because you see, different stages of your life, you're vulnerable to the sleep. So we have to foolproof it, knowing it. But the information is not there. So that's the message. So that I believe the world will be much better, happier, calmer place if we all sleep better. I want to create the sleep revolution. I'm on many TV, radio,
Yeah.
podcasts, USA Today, everywhere trying to talk about this. And I really
Uh-huh.
appreciate you giving me the opportunity to come and share with your viewers.
Yeah, Dr. John, the sleep doctor. One more
Yes,
last question, Dr. John.
yes,
Is
sir.
there anything else in your heart that you want to share with us today that we haven't talked about?
Oh, so we talked about how sleep affects your sex drive. so,
Mm,
so the conditions like sleep apnea, when you have apnea, there's not oxygen flowing. One of the reasons I see young men in my clinic is the lack of libido. It's a lot. It's going through the roof because there's less oxygen to the sexual organs, and you're not making enough testosterone. Also, in women, they're so tired to make love. So by sleeping better, you can you 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 can cure all that, and you have the urge and the desire. And for men, the testosterone level comes up. So sleep affects head to toe. Uh,
mhm.
so it all is a huge thing. It's one of those treatable causes of sexual dysfunction.
Well, Dr. John, I'm persuaded that good sleep cures a lot of ills. So,
Yes.
yeah. Hey, look, I really enjoyed. I didn't know that sleep could be so exciting. Talking about sleep, but it's exciting. Yeah. So
We can
thank you
talk for
so.
hours. Yeah.
Yeah. Look, thank you so much for saying yes when I invited you to this platform. I really enjoyed our conversation.
Steven, thanks for having me. I hope your viewers are empowered because we are all in it together, right? So once we sleep better, we'll take that one step. When you think about diet, when you think about working out, add this as the triangle, the third piece, and which is going to turn around everything else.
Yeah.
So it's within you, it's free. It just takes some discipline where, from 2 to 4, weeks you can get on track and then you will be a much better person.
That sounds good. Well, you've been listening to the Possibility Action Network podcast. Our guest today has been Dr. Bijoy John, the author of Nobody is Sleeping. I'm your host, Stephen Middleton. Until next time, good day.
You are not alone. Just keep on, keep on, keep on going. Just press on, press on, press on.